Nature's best, Bobtail.
Well, it's so great to take a look at all the inspirational women in South Africa. But this morning, we are talking about pet medical insurance. Now, just like any medical facility for us humans, taking your pet to the vet could prove to be an expensive exercise. Let's say something unexpected happens to your perfectly healthy pet. You could be left facing a very large sum of money. And this morning, we have Dr. Roy Aronson, our Expresso vet, to join us to tell us about pet medical insurance. Can it really help? Do we really need it? Dr. Roy, what's your take on it?
Well, Ewan, first of all, I must say that pet medical aid actually does exist, because we get a lot of people who ask us, is there a medical aid? And yes, it does exist. You know, I suppose the big thing is that medical, veterinary, dentistry, anything medical has become expensive. And a lot of the times, the imaging that we need to do in order to make a diagnosis is very expensive. If your dog has a spinal problem, you need to do, it's called an MRI, a magnetic resonance imaging scan, or a CT scan. If there's internal organ damage, you need ultrasound. And these techniques and the pieces of equipment are hugely expensive. And whether it's human or veterinary, if you use these things, it's expensive.
It's pretty much the same thing.
Yeah, and in the humans, you have a medical aid which picks up the basket of expenses. So the people don't exactly feel it.
Yeah.
Whereas in veterinary, it's really privately funded. And as I said, there is medical aid. There are a couple of companies that do this. And my advice, once again, get thee to a vet, it's my saying, you know.
Yeah.
But your vet has medical aid application forms of a number of companies. It's not as though he's marketing one. And contrary to, you know, I've heard, oh, you get commission on the sales. We don't get commission on the sales.
Yeah.
These are privately funded companies. And we offer this as a service to our clients. They have a number of choices, and they're very good. It's relatively inexpensive.
So, just to stop you there, so what are some of the common problems that you see, you know, for your pets come into the vet for, that could end up, you know, costing quite a bit?
Well, there are two broad things. There's the surgical side and the medical side. Surgery, if the animal has a broken bone, there's some sort of internal damage where you can actually go in with a knife and fix. And then the medical side is like an erosive disease, heart failure, kidney failure, organ failure, cancer. I mean, the cancer treatments have become very, very sophisticated. There are cancers that we can take the animal, treat them and put them into remission, and they have 5 years of great quality life. So these are expensive things. And if you have a medical aid, then you as the pet owner can authorize the vet to employ the most sophisticated techniques to fix your pet.
This proper way of looking after your pet. But what happens in the instance when a pet is brought in but the owner can't afford that cost? I mean, what happens?
Well, you know, all the vets that I know, myself, every one of us, we have a little charity basket. We definitely, we do our stuff. I personally don't know of a vet who would turn away an animal without giving it some, what we call buddy care, an antibiotic, anti-inflammatory, pain-killing. There are welfare organizations that can pick up some of the costs, that can pick up some of the treatments, but no vet will turn an injured animal away without giving it buddy care. Absolutely not.
And recently in South Africa, I mean, how popular did pet medical insurance evolved over the past couple of years?
Well, the sad part is that it's not as popular as it should be. In the British model, some of the practices have 80 to 90% of their clients are covered by medical aid. In our practices in South Africa, if you really are lucky, about 15% of your clients are covered. So there's a big market out there, and it's a great option. And it's 100 to 150 bucks per month for the first pet.
Okay.
So it's the kind of thing that you don't really want to claim. You know, you don't want to have your pet, God forbid, smashed up, and you have to claim. But if your animal does get sick and injured, then if you have the medical aid, well, you can do the best you can for him.
So it's not even that expensive, but it can end up saving a lot of money. Dr. Roy, thank you so much for joining us. Always nice to see you, because we know it's Friday. But of course, remember, you can ask any question to Dr. Roy. You can follow him on Twitter at The African Vet, or find him on Facebook at Dr. Roy Aronson, or just Dr. Roy, or just Roy Aronson. We'll see you guys straight after the break. We are not done yet.